Hi friends, today we will discuss about regarding IV fluids. There are two types mainly, crystalloids and colloids. They are divided into two types. Crystalloids generally we are normal setting, we are using what is NS, RL, dextrose, 10% dextrose. These are the crystalloids. Colloids will use in specific conditions only. Okay, now we will discuss about IV fluids. General condition we are using hypertonic. There are three types: hypertonic, isotonic, hypotonic. Okay, isotonic we will first discuss with isotonic. Isotonic is 0.9% is a normal concentration. What in our body fluids, what are the concentration is like same like that only the concentration will be there. That is called isotonic. Hypotonic means more means increase more than 0.9%. What are the fluids we are giving, that is comes under hypertonic solution. Okay, 3%, 5%, 10%, everything is hypertonic. Now we will discuss about hypotonic. Hypotonic means low. Hypo means low concentration means 0.9% below concentration will comes under hypotonic. Example 0.45, 0.45 percentage will is a hypotonic solution, and 0.33 concentration, and again 0.225 percentage. These three are hypotonic solutions. Okay, whatever 0.9 above will comes under hypertonic, 0.9 below comes under hypotonic. Okay, this is 0.9 percentage NS. NS is a isotonic solution. Hypotonic 3%, in 3% we will see what we are having, the 3% NaCl, sodium chloride, 3% solution. IV fluid we are giving, no, that is hypertonic. And 5%, in 5% there is a dextrose, and 10% also we have a dextrose. 5% dextrose solution, 10% dextrose solution. These two also hypertonic solution. These are the examples for hypertonic. Okay, in hypertonic DNS also will come. Okay, RL will come under isotonic. Isotonic 0.9% NS and RL, hypotonic 0.45, 0.33, 0.225. Okay, 0.45 we can also call as half NS. Okay, 0.33 percentage we call 1/3 NS. 0.225 percentage we call 1/4 NS. Okay, in general hospital settings 0.45 NS, half NS is available. 0.33, 0.225 are not available in normal hospital settings. It is available in abroad hospitals, like specifically pediatric hospitals, some specialized hospital when they need like 3.33%, 1/3 NS they are having. But normal in our general hospitals we don't have, only half NS we have. Okay, these are the main three types in IV fluids. Okay, next we will see hypertonic in detail. If we are giving hypertonic solution to any patient inside the body, what will happen? In hypertonic solution, in hypertonic solution we will see more salts will be there in the solution and less water. That is why more concentration will be there in hypertonic solution. If we are giving inside the blood, means this is the intravenous fluid only, it will mix into the blood only. So what will happen in between the blood and the cells? If we are giving intravenously, it has more salts and less water. It will go into the blood vessels. The cell inside the water also there. In every cell there is a cell concentration of some water will be is there. What the cell thinks, that is a hypertonic, matlab more salts and more concentration is there. We have to dilute that, like that the cell thinks, and the cell water from the cell, the water enters into the blood vessels. Okay, just see there is a more concentration. Okay, the blood from the cell, the water enters into the vein, okay, to dilute the concentration. Like this it will enters into the blood vessels. Water enter into vein, exit from cell, okay. After, if the water is enters into the vein, the cell become shrink means it will come to like a small cell. If it is normal cell, that smell the cell size is very small, shrink. If no water, there is a no normal shape in the cell, okay. This is regarding hypertonic, okay. Clear? Hypertonic solution regarding hyper means you can understand, hyper means more active, like that we will think, no, like that only. More concentration from the cell, water enters into the vein, the cell becomes small size, like shrinks, okay. This is the main, because you will get questions on hypertonic, isotonic, get questions on hypertonic, isotonic. If this fluid is giving to particular person in particular scenario, what will happen to that patient, like that they will ask. Or which concentration you will use, which concentration is isotonic, which concentration is hypertonic, like that questions will you will get that in the questions, okay. In exams, isotonic solution is 0.9%, same concentration as a body fluids, okay. So no any changes between the blood vessels and the cells, anything, no fluid shift will be there in isotonic. Iso means same. See, hyper means more, iso means same, hypo means low. Okay, you can identify these tricks, then you will get the answer easily. Okay, hyper means more, iso means same, hypo means low, okay. This is the isotone, nothing will be happen, it is like a body, same body fluids only. It will give normally like our body fluids, like that only, though there is no shift changes in the volumes, means fluid. Next we will see hypotonic solution. Hypo means low, okay. Hypo means low, below 0.9%. What are the fluids? We already told 0.45 percentage, 0.33 percentage, 0.225 percentage, okay. Is in hypotonic there is a less salts, means less concentration, and more water will be there. In this hypotonic solution, what will happen? We will see in the blood and the cell. There is a hypertonic is different, hypotonic is different. If we will see in blood, this is also like a intravenous IV fluid only. We will see it will enters into the blood vessels. The hypotonic solution enters into the blood vessels. Okay. After entering into the blood vessels, um, what the mechanism like that happen is, there is a more water in the blood vessels. Then what will happen? The more water will enter into the cell to normalize the in blood vessels, okay. Body fluids, it will enters into the cell, then cell size will be increased. Then what will happen? Cell swells, the cell size is increased, swells. In hypertonic, shell will shrink, small size it become. In this hypertonic, cell size is increase more, means cell swells. The water go out of the vein, enters into the cell. In hypertonic, The water enters into the vein, exit from the cell. Like same in opposite in hypotonic solution we will see. Okay, you can the trick you can understand. Hyper means more concentration solution, no? In more concentration solution the cell will be shrinks, small size. Cell will come small size. In hypotonic is low concentration, low size, the cell is becomes swells. There is a trick like opposite. Hypotonic means more concentration, in cell shrinks. There is a difference, you can see. These are the IV fluids isotonic. In normal we will see. In real IV fluid 5% extra, this is hypertonic. RL also isotonic only. DNS is the hypertonic only. Okay, hypertonic, this is isotonic fluids.